Kangra currently is the epicenter of the COVID pandemic in Himachal Pradesh. So here we come in as Dharamshala COVID Saviors. What we're doing is basically we're trying to support the COVID patients who are at home. We are trying to bridge the gap between the administration and the patients. We basically in the beginning there were 5 friends. So what we did was the 5 of us, we pitched in some money, we pitched in whatever amount we could, that it is not the battle of a single person. It is the battle of the people of Dharamshala, of the people of Kangra, of the people of Himachal Pradesh. We need to fight with this problem by holding hands together and coming together as a community. In when we are together, we can do and achieve much more. This is not the time to do politics. This is the time for humanity. People from across the political spectrums, from left, right, and center, need to come together and need to work together, be it from the Congress, be it from the left or the BJP or any other organization. At this point, humanity comes before everything else. I think till people require us, we will be here to help them. Till people are there, till people need our help, we will be here to help them.
You're watching Himachal Watcher. As we know, Himachal Pradesh, like rest of the nation, is reeling under the second wave of the pandemic. The state is under corona curfew, which is a sort of partial lockdown. But people are again face to face with the crisis. Organizations and individuals are coming ahead for relief work. The Corona Saviours Dharamshala is one such organization where youth is carrying out relief work around Dharamshala, the epicenter of the pandemic. Youth have evolved their own model for efficient operation. They are gaining appreciation. Today, we are glad to have with us one of the founders of the organization, Mr. Shashwat Kapoor. We would be discussing the policy approach he has taken for carrying out relief work in Dharamshala. Mr. Kapoor holds an engineering degree from Thapar University. He has also studied MBA from prestigious INSEAD Institute in Paris. Mr. Shashwat, thanks for joining us today.
Thank you very much, Madanji, and thank you, Himachal Watcher, for having me here with you and for giving me this opportunity to reach out to people through your medium.
Shashwatji, as we know that Kangra is the epicenter of pandemic in Himachal Pradesh, and it has been reporting the highest number of cases and fatalities. And your group as Corona Saviors is carrying out relief work. We are trying to understand your model for operation. Tell us more about it.
Okay, so Madanji, you are right about the number of cases which have been surging for the past few days in Kangra. Kangra currently is the epicenter of the COVID pandemic in Himachal Pradesh. And daily we are getting around 1,500 cases. And because of that, our health infrastructure is heavily pressurized, especially because there are so many number of patients and the number of beds in related to the patients are very low. And because of that, a lot of people, majority of people, I think around about 90% of the people have to fight this pandemic staying at their home in home isolation. And because the number is so huge that even the authorities are somewhere, I believe that because of so much pressure, they are not so much capable of providing those people who are in home isolation with the support and with the facilities that they need at this moment. So here we come in as Dharamshala COVID Saviors. We are currently operating in the town of Dharamshala and the places around it. And what we're doing is basically we're trying to support the COVID patients who are at home. We are trying to bridge the gap between the administration and the patients. So if I tell you about the story of COVID Saviors, we basically in the beginning there were 5 friends who had been talking. We were 5 friends who used to discuss and talk on the phone about the problem, about the pandemic which was surging. And so we decided that there needs to be some kind of support that needs to be there, and we also wanted to do something from ourselves for the society. So the 5 people who were there in the beginning were Mr. Akash Nehria, Mr. Abhinav Singh, Mr. Abhikshit Sharma, Mr. Pankaj Kumar, and me. And so we did a virtual meeting, and we decided that we were going to help the people needy people in Dharamshala by providing them with food and medicines. And so, in this context, we went and we met with the SDM, Mr. Harish Kajju, and we also had a meeting with Mr. Gurdarshan Gupta, the CMO of Kangra, and we discussed with them that we were willing to help those people who are in home isolation or those COVID patients in whatever way we can. And from these meetings, it came out that the main problem that was there in Kangra district was that because of the rising number of patients, it was not the administration was not able to identify those patients who needed hospitalization or who needed medical support from in a hospital. And so for that, to identify those people who need to go to the hospital, there was this there is this oximeter which is there. So oximeter basically is a device which tells you the pulse and the oxygen level, the SpO2, the oxygen saturation in your blood. And what happens in COVID? A lot of deaths that are coming up are because of lungs collapsing, and because of COVID, it attacks on your lungs. You get pneumonia in severe cases, and then because of because of because of limited oxygen supply to your lungs, they collapse, and then it results to the patient's death. So we wanted, but if the patient reaches the hospital on time, then their lives could be saved. So what we wanted to do was we wanted to help people get to the hospitals, reach the hospitals on time, and that is why we decided that we would arrange some oximeters, and we would then uh, give it to the COVID patients who are at home. So what we did was the five of us, we pitched in some money, we pitched in whatever amount we could, and we collected some amount, and then we ordered some oximeters. At that time, the rate of oximeters was also very high in the market. You're getting it for like 1500 at least, and like 15 1600 was the starting price. And we thought that a lot of people who are not so capable, who are not so financially so well off, are unable to buy these oximeters for themselves. So because of that, we pitched in some money and we arranged 50 50 oximeters. And after that, we decided that we would distribute them to people. See, even before the administration, the health administration had already uh, distributed 2000 oximeters, but where were they in this time? That was the question. And that was not available to the people because many people have had taken those oximeters and kept them at their places, at their homes. And because of that, the real COVID patients who needed these oximeters at this moment were not being able to get them, to procure them from anywhere. So we came in to help. And what we did was we thought that instead of just donating the oximeters to a COVID patient, we would instead start with the lending model, that we would give the oximeter to a person for a period of 14 days, or till they are COVID positive. And after they come out to be negative, after they've fought this war with COVID, we would take it and then we would give it to someone else. So we decided to go through this cyclic process of lending and then taking it back and giving it to some other needy person. So then after that, we made a Google form and we started taking entries from people. And in that Google form, people had to enter their details like their name, their age, their address, and also how many people are positive in their family, and their COVID positive report. And so the number of patients who were coming in Dharamshala, their list was being shared to us every day. And then on the volunteers group, we had a meeting, and then we decided that we would form two groups. Basically, we would make one team for calling, and the other team we would make for deliveries. And we started taking their requirements. The calling team, there were like 200 numbers which were there to call for the first day, and then we took in like 7 people, 8 people were there who started calling. And they would take requirements from every COVID patient who was there. They would ask they would ask every COVID patient if medicines were being delivered to them, if they were able to get food, if everyone in their family was positive and they needed food, then we decided that we would give them food. And over time, over like we started working on this, and with time we evolved. And then we decided that it is better that if we take all the requirements that a calling team calls all the COVID patients in the first half, and in the second half we do the delivery. So that is how we're working right now. So basically we get all sorts of requests from people, like our volunteers call them. So they have our volunteers number. So if there is some patient whose condition is deteriorating and who wants to go to a hospital, we get calls from people requesting for ambulances. We get calls from people requesting for beds at times. We get calls from people requesting for oxygen cylinders. And we haven't yet started providing them with oxygen cylinders, but we are working on that. By Wednesday, we were in talks with the BAPS, uh, the Swaminarayan Sanstha, which is there, which is working for people, and they have been very kind enough to provide us with 5 oxygen concentrators, which will be reaching us by Wednesday. So from Wednesday, we will also be providing people with oxygen support, whoever need it. And we get all types of requests. Like recently, 2 days back, there was a request by a lady who was at home with her children. Her children were young, and her mother-in-law was in the hospital, and her husband was somewhere outside, was not living with her. So she wanted to provide some like a blanket and some utensils to her mother in the hospital. So we asked a volunteer, and we arranged the blanket and the utensils, and we gave it to her. We delivered it to the hospital. And there was some days back, there was also another request from a pregnant lady who had just had a delivery done like some days ago. And she wanted some medicines for basically for her, I would say, dressing. Yeah, the ASHA workers told us that they could not provide it to them because of various reasons. I think because of the financial reasons that were there. So we also provided her uh, with all the medicine that she required. She sent us a list, and we asked a volunteer to go and deliver that to her. So basically, all these kinds of requests we're getting, and we are trying to support the COVID patients who are in home isolation, who cannot get out from their house in whatever way possible. Some days ago, we have also delivered a steamer to a COVID patient. She did not have a steamer. Her age was like, she was around above 60. She was a senior citizen, and she said that she wanted a steamer, so we provided that to her. So it all depends on the genuinity of the demand that people are asking us. We have also gotten weird demands, like someone has asked us to get batteries for their remote, and some other people have also asked us to get uh, real juices for them, or like all sorts of problems that we're getting. But we only look at a genuine demand which is there, because see, all of us are volunteers basically. No one is getting paid to do this job, and whatever work we're doing, all of our expenses are borne by ourselves, by our volunteers. So it is people from the community trying to help the community.
Your group is not taking any donations or any assistance from outside from any other body or person.
uh, no, we are taking donations, but we're not taking donations on a regular basis. We are taking donations when we need them. I would say that this is not the model of a single person, but this is a model of the community, because people from the community are coming for help for people of the community. So I would say that all of this, our volunteers are from the community. The people who are donating for us are from the community, and this entire organization is being run from the community, I think, basically.
So people from across the political spectrum, they are also involved in the relief work. But there are reports that they are being tagged as to a particular ideology, which is keeping them from coming together. Do
Right.
you agree?
Unfortunately, there have been certain cases where we have seen that people, because of being from different, because of the political divide that is there between they are not coming on a single. They're not coming together to work, which I feel is very unfortunate, because at this time, This is not the time to do politics. This is the time for humanity, to come up for humanity. And I feel and I believe that people from across the political spectrums, from left, right, and center, need to come together and need to work together for humanity at this moment. And I'm ready to work with anyone, be it from any political organization, be it from the Congress, be it from the left or the BJP or any other organization. I'm ready to work with everyone at this, because I feel that at this point humanity comes before everything else.
How many volunteers are there right now in your group?
See, currently in our group we have in our WhatsApp group, if I talk about that, we have around 90 people who have come forward for volunteering. And out of those 90 people, about 45 of them are very active, like half of them are very active. And I think 13 or 14 people are there in our calling team, and the rest of the people are there in our delivery team who do deliveries.
How many teams you have divided volunteers?
So basically, we have a calling team, we have a delivery team, we have a food team, we have an oximeters team, we have a volunteers team, and now we are also coming up with an oxygen support team. So I think almost six teams that we have.
So it would be correct to say that your model is still evolving.
Yeah, right. It is definitely. It is still evolving, and I feel that it will keep on evolving, because we will look at the requirements and the problems that we are facing, and we will try to tackle them with time. So I wouldn't say that there is a rigid answer or a rigid answer to these problems. It will. I believe that it will keep on evolving.
The pandemic now, second wave is heading towards the peak, and it's going to take some time before the curve flattens. And the government has also already warned about the third wave. So I just wanted to ask how long you plan to carry on with this relief work, or because you don't know how much time it will take for the pandemic, for the numbers to come down.
See, we're not sure how much long we will work for this, because I think till people require us, we will be here to help them. Till people are there, till people need our help, we will be here to help them. And I believe that in the coming days, hopefully, the numbers will die down. Like the surge which is there right now, that will probably come down, and probably at that time the health infrastructure will be capable to cater to those people by their own. If there are 10 patients or 5 patients or something like that, I don't think that they would be needing us anymore. But right now, that because there are so many patients, they need us. So I think it depends on the need that is there. So if people need us, then we will be there.
So, would it be correct to say that a civil society is, coming up and has collaborated with the district administration and working with the district administration instead of just working alone? And whether this model is more efficient than working alone?
Yeah, I think yes. This is it's right to say that this model is currently, because whatever work we're doing it with the help of the district administration, with the help of the local administration, and it is definitely better than being alone, because I think that in when we are together, we can do and achieve much more. And they have been helping us in various things, like information is being provided to us. And at times when there are medicines to be delivered, we ask them, we request them to, like, we inform them that medicines have not been delivered to this person, to this particular patient, and then they have been acting on that. So yes, we have been in close coordination with the local administration. And I think that it is better that if we work together as a community uh, with the administration.
Do you think should this model be replicated across Himachal?
Yes, definitely. I think that it is very easily replicable, and if we work in coordination together, we can achieve much more. And mm, it is not so difficult to do or to carry out. And at this age, when we are living in a digital age, when all of us are connected through our mobile phones, the entire world right now is running uh, on phones, and this interview that also we're doing is virtually. So I think that it is very easy to do these things without any added cost. All of these tools are available to us for free. So we just need to organize ourselves in a way that we can be in close, then we can work in close coordination with the administration and the people, and that we can bring all of them on a single platform, and then go forward and tackle all the difficulties in that manner. And it is also important to note that it is not the battle of a single person. It is not my battle, or it is not just your battle. It is the battle of the people of Dharamshala, of the people of Kangra, of the people of Himachal Pradesh, and of the people of India, of the entire world, in fact. So, what we need to do is that we need to fight with this problem by holding hands together and coming together as a community.
So, Mr. Kapoor, would it be correct to say that the government and the people were not prepared for the second wave?
I would say that the number of cases that have been rising at this moment are unprecedented. No one, I don't think that anyone had imagined that we would get such a high positivity rate, and that there would be so many patients in Himachal. So I believe that, yeah, somewhere the people were caught off guard because of this wave that has come, and but there have been efforts uh, to fight this by the government. The government is also trying to evolve in its tackling of the problem.
Are you, are you satisfied with the efforts of the government to contain the spread and to manage the crisis it has created?
I believe that the government is doing its bit, and but it is also heavily pressurized because of the number of cases that are there.
Mr. Shashwat, thanks for being with us and speaking to us.
Thank you very much, Mr. Madan, and the entire team of Himachal Watcher for having us here. And I would like to thank you from my side and from the entire team of Dharamshala COVID Saviors for giving us this opportunity to be here, to talk to you about us and about how we're trying to help the people. And I would also like to congratulate you for the amazing work that Himachal Watcher has been doing. Uh, I have been a long time reader of your magazine, and I believe that it is also one of the oldest running English magazines in the state of Himachal Pradesh, and you have been doing a great job in terms of independent journalism. So I would like to thank you for all the work that you have done, and I believe that you will continue to do so, and you will continue to uh, appreciate and to bring forth people like us, like our NGOs who are working on the ground for the community. Thanks a lot.